Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking with interventional cardiologist B. Ramesh Reddy. Dr. Reddy, it's amazing the work that's done every day for improve people's health, but I'm wondering if there's anything new in technology.
There's a lot of research going on in the field of interventional cardiology. We are getting newer stents that are, smaller, easier to introduce. But perhaps the most significant impact is a device called the heart pump that is inserted through the skin percutaneously. In the last couple of years, that has really made a big difference in treating patients who are really sick, and that's called the Impella Heart Pump, used in a couple of scenarios to help us do high-risk interventions, people who have a lot of blockages, a lot of heart muscle at risk. For those kind of interventions, when we do the multiple vessels, this pump seems to have a big impact in safety and improving the outcomes.
So help me understand what kind of patients might benefit from this Impella pump. It isn't like you should just walk in and say to your doctor, hey, I heard there's a new pump, I want it. That's not how it's used.
No, it's used very selectively in certain selected scenarios. One scenario is when somebody comes in with a very massive heart attack. There's a lot of damage to the heart muscle. Heart, instead of pumping out 4.5 liters a minute, is only doing 1.5 liters. In that scenario, this heart pump comes in and we insert it through the skin from the groin usually, and it gives enough support and bumps up that 1.5 liter output to nearly 3.5 liters. So that's where the pump comes in help. That's called in a shock patients with a heart attack. The other scenario is when patients have multiple blockages in large vessels, and when you're trying to open up multiple vessels at the same time, you're putting a greater risk on the heart muscle. And in that scenario, you offer protection by putting this pump, giving enough output out of the heart to supply the entire part of the body when this happens.
Can you show us the device and tell us how this procedure goes?
Sure. I think we have a little picture here that can tell us. It's a typically for the heart, we go from the groin area and we insert a small catheter that goes up right into the heart, into the left ventricle. And maybe the next slide will give us a better idea. This is how the pump is. The motor for the pump is here, and this is the tip. This sits in the main chamber of the heart called left ventricle, and it sucks the blood from here and puts out from here. So instead of the heart doing all the pumping, this motor draws the blood from inside the chamber of the heart to put it out into the aorta, and thereby improving the blood flow. So from here, it sucks the blood, puts it out, allows the heart not to work so hard while we are doing the intervention. I think we have a nice animation of that as well. This is the smallest heart pump that we use, and we generally go from the groin to implant it. Typically, you can see that the pump is being advanced up from the groin through the aorta. It goes all the way into the heart and then slowly comes in to be accommodated. The blue structure is the pump that's coming, and that sits right inside the heart, and then it starts pumping the blood from this chamber into the main chamber outside. Normally, heart puts out about 4.5 liters a minute. When that goes down, this comes and supplements that output, thereby allowing us to do procedures so that the heart recovers in a more efficient manner.
Is that pumping constantly? Is that constantly sucking?
It is. Once the pump is on, it takes the blood from the main chamber and puts it out, and it keeps on doing as we are working on the other side, opening up the arteries. And that's really called as a high-risk intervention, heart pump assisted procedure.
So how does this, having this available, improve the long-term outcomes for patients?
Long-term outcomes are not as adequately studied yet, but definitely there is a significant improvement in the immediate 30-day outcomes and also on the long-term outcomes. But a patient can have more of the arteries opened while his heart is still weak, And when you have damage to the heart, the recovery process is much quicker. And this is the pump that has made the difference, and this is a big change in interventional cardiology now.
So this device, do you leave it in the heart, or do you take it out when you're done, or how does that work?
There are two kinds of scenarios. When you're doing high-risk interventions, you use the device as a support, do the intervention, that is putting stents in all the 3 arteries if necessary, then the device comes out and patient goes home in the next 24 to 48 hours. That's one scenario. In the other scenario, when patients come in with a very massive heart attack, we leave the device in for 2 to 3 days, allowing the heart to recover as this happens. And in that scenario, the device will be in the system for maybe 24, 48 hours, or even 72 hours sometimes. So there are 2 separate ways of using the device.
So very simply, it helps a heart that is weak or damaged. It just gives it support.
It is really a device that supports the heart and allows us to do more interventions in a much more safe and protected environment.
Wow, that's amazing technology. You've given us a lot of good information today, Dr. Reddy. Do you have any closing comments?
Well, basically, if you have a heart attack, the best place to be is here in Port Huron, because our response times are excellent. We are trying to do this under 60 minutes in terms of opening up the artery. And another important thing to remember is to prevent this disease. Eat right, stay healthy, quit smoking, see your doctor regularly, take the medications as advised, and if you end up having a heart attack, unfortunately, seek immediate medical attention, call 911, open the front door, sit back, and let the EMT come and take it from there.
Thank you so much for joining us.
You're welcome.
Thank you for joining us. If you have any questions about anything we've talked about today, call us at Health Access. That's 1-800-228-1484. Or you can go to our website, mclaren.org/PHcontact. You know, you can get a copy of this program. You can always get great, reliable health information at our website, and that's mclaren.org/PHTH. Join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.